Hi everyone, it's me, Melanie, your IVF nurse, and I just wanted to touch base with everyone during this time, only because people that are still having to go to doctor's appointments, whether you're mid-cycle, whether you're an OB patient, so if you're currently pregnant and you have to get into the obstetrician or midwife to have your prenatal appointments. I just wanted to review some of the things that you can expect to encounter. Now, we're always knowing in light of recent days that things are rapidly changing with COVID-19. So the screening questions are a general guideline as to what to expect when you're entering a medical office or if you're entering the hospital. Now, screening stations are set up at various facilities before anyone is even allowed to enter, because we're all trying to do our part in minimizing the risk of passing this on, or we're trying to flatten the curve. Now, one of the things that you can expect in terms of questions is that they're going to ask, do you have any of the following symptoms? So do you have a fever, new cough, cold, difficulty breathing? Um, have you traveled outside of Canada in the last 14 days? That's a big thing, but now we're seeing a shift in community transmission. So if you've traveled outside of Canada, they're going to ask you where you went. They're also going to ask you, do you know someone or have you been in contact with someone that has traveled recently as well within the last 14 days? And they're going to ask you, if yes, where did they go? The other thing they're going to ask you as well is if you personally or someone in your household, when you're in self-isolation, has come into contact with someone who has been sick or is, in contact with someone who has COVID-19. So, if you're going to a clinic and say you're living at home with your family, but you've got a family member that's a nurse or a doctor that's working the front lines. So those kinds of questions, if you're answering yes to any of them, they will advise you what to do. And it may be to contact your primary health care provider, so your family doctor. It may also be to contact telehealth for further information. Phone number for Telehealth Ontario, 1-866-797-0000, and you'll be able to speak to a registered nurse who can advise you of what your next steps should be, whether it is to continue to stay home and self-isolate and monitor symptoms, or if you need to get out to a testing center. Now, one of the things that many clinics are doing is, or doctors' offices, if you're trying to get in to see them, they're doing telephone questionnaires over the phone. They're assessing the situation, and then from there, the doctor is calling to see. So there has been a huge shift to virtual kind of aspect to medicine, just to flatten the curve. So we're all trying to do our part. Me, myself, I have not traveled anywhere, and I haven't been in contact with anyone who has traveled recently. My business pretty much keeps me local. That being said, I have kind of shifted to the fact that online support services are still available. So if you're interested, you can please reach out to me, whether it is something where you want to Skype or FaceTime in order to be talked through your injection. If you've got questions, many times with cycle monitoring, you may be going in if you're currently in cycle. Many clinics have decided to finish up those cycles and then delay frozen embryo transfers. They're doing a freeze-all approach. So if you are currently mid-cycle or starting your cycle because you're doing fertility preservation for prior to starting chemotherapy, and you need some assistance with getting your injections done, most definitely reach out to me. We can do it via FaceTime. I can talk you through it. I've got a collection of supplies here so that I'm able to do that with you, and it doesn't matter the time frame that it takes via FaceTime or Skype, whatever is easiest for you to get through this and help you in your journey as you're in this part. Now, for those of you that have had your cycles canceled, my heart breaks for you, only because I know that you've waited many months, whether it's for your funded cycle or you've done your funded cycle and now you're wanting to proceed with funded frozen embryo transfers. All of those are going to be delayed inevitably until we start to see the flattening of this curve. So we all need to be patient during this time and stay inside and, hopefully be. You can follow me on Instagram at Your IVF Nurse. For general information about services, you can email yourivfnurse@gmail.com. If you're looking for something specific, email me directly at melanie@yourivfnurse.com. You can subscribe to my YouTube channel or comment down below. Take care.